The AMAMUS Vet application protocol: always rinse first, then apply the cold plasma, and now treat each treatment area for 30 to 60 seconds, then move on. That is completely sufficient, yes. The treatment area is about this size, maybe a bit larger, because you usually don't place it directly on, but keep a slight distance. If you touch it in between, it's absolutely not a problem. You can also make contact, but you can also work without touching. Especially in areas that are more inflamed or painful, it makes sense to keep a bit of distance. After 30 seconds, there will be a small beep, then you can move on to the next spot. For the ear, please treat each ear for 3 minutes. Why? We need a bit more time until the entire ear canal is really filled with the reactive oxygen and nitrogen species and until they have had their effect. After the cold plasma treatment, apply gel, cream, or the eardrop. You always use gel when it comes to tissue regeneration, because in that case, we don't want any fat involved. That's why we use pure hydrogel with hyaluronic acid, aloe vera, microsilver, and panthenol. For the ear, of course, use the eardrops. These are essentially the same as the gel, but much more liquid, and please don't use too much. Less is more in this case. And for anything related to the skin, use the derm cream. Again, you don't need to apply it thickly so that it sits on top. It's enough if you apply it thinly. What we mainly want is for the hyaluronic acid to work in and on the skin, and you don't need much for that. Less is sometimes more here as well. And with that, you have a protocol: rinse with rinse, cold plasma, ViroCap treatment, and then derm care. Always the same, very simple, so that no mistakes can happen. There are a few distinctions. For example, if you want to go deeper, like with the ear or with abscesses, then please hold it on for 3 minutes. For anything you see that's superficial, 30 to 60 seconds is enough. How often should you use it? Every 3 to 5 days, so let's say twice a week in the practice for the whole system, and then you give rinse and the derm care products to the pet owners so they can rinse and care for their pets at home once a day. That's where we have a difference. As for the delicate area around the ears, it is usually enough if you perform a gentle rinse about twice every week. However, you can certainly go ahead and continue to apply the prescribed ear drops on a daily basis.